My name is Ole Antonishin. I'm a plastic surgeon at Sunnybrook Health Sciences Centre. Last year, I joined a Canadian urgent medical needs assessment group, and we traveled to the Ukraine to determine what the needs were of civilians who were injured in demonstrations on the Maidan in Ukraine. And following that, there were several initiatives that were undertaken, and one of the primary initiatives was a surgical initiative to collect a group of surgeons, anesthetists, and nurses in Canada that could travel to Ukraine to administer to those patients with post-traumatic defects and deformities. We chose to perform those operative procedures in the main military hospital in Kiev. In total, we performed 37 major reconstructive operations in 30 patients. And these were extremely complex, difficult procedures that included reconstructions of the skull, reconstructions of orbits, mandibles, midface, nose, and so on. And all of these defects and deformities, for the most part, resulted from missile wounds, artillery fire, or sniper bullets. The surgeons in Ukraine were extremely skilled surgeons, but they did not have some of that technical equipment that we would have that makes that surgery so much easier. So part of our mission was to work in collaboration with them, exchange some knowledge and technique, but also to provide them with the tools to do that surgery. So we left all the surgical tools that we brought with us for them, so that they could continue doing those very same operative procedures, because their work continues and the conflict continues, and there's just so many people to administer to. And this lays the foundation for those ongoing educational efforts. We're also hoping to perform yet a second mission, and most likely will be within the next 6 months. Patients were extremely grateful, because these were services that would otherwise not be provided to them, that they would not have access to. Many had had significant deformities for months before we got there. This was an extremely rewarding experience for all of those surgeons, nurses, and physicians that were involved in this effort.